Welcome back. All our top stories can be found on our website, and that's channelstv.com, and on youtube.com/channelsweb. Log on to m.channelstv.com to see us live on your mobile device. You can also download the Channels TV app for Android, iOS, and Windows phones from their respective stores. Having the Channels TV and Channels 24 app will give you access to news and updates. You can also have the Eyewitness feature, so you too can be part of the news. Just install the app, then tap and swipe to reveal the Eyewitness menu and follow the instructions to share those pictures, videos, or news of happenings around you. It's one day at a time for internally displaced persons displaced by the insurgency in the northeastern part of the country as they hold on to the hope that their ordeal will soon be over. There's more support coming their way with a new pledge by the United Nations to beef up humanitarian support for the victims and restore normalcy to vulnerable areas. The country director of the United Nations Development Program, Mr. Jan Thomas Himstra, says the UNDP is going to put more presence in the Northeast because the humanitarian crisis has grown beyond the camps as aid workers constantly look out for where people are really suffering. According to him, the military have done their work. It's time to bring back agriculture, rebuild homes, hospitals, and schools.
That UNDP is going to put more presence in this area because we believe that the situation for Nigerian people have evolved to outside of a humanitarian situation. The military has done their work. The humanitarian are still looking at where are the people that are really suffering and have no food, but the development program has to come in also to say, okay, it's not only about food, it's about jobs, it's about business, it is about agriculture, it is about people coming back, they're rebuilding houses, rebuilding secretariat buildings, rebuilding clinic, rebuilding school. So this is the next phase that will have to happen together with humanitarian work. The United Nations Development Program is a specialized agency that will work with all the other agencies to work towards recovery and development in the Northeast. And we reassured the General Office Command that we will be beefing up our office here and our activities.
The Nigerian Air Force has commissioned a cancer screening and registry center in Kaduna State, northwest Nigeria. The project, which is an initiative of the Chief of Air Staff, is part of efforts to pay significant attention to the general well-being of their personnel. During the commissioning of the center, the leadership of the Air Force says the aim is to provide personnel, their families, and members of host communities the opportunity to carry out routine medical checks.
In order to, and these are some of
the Nigerian Air Force personnel and their families are not immune. And these are things that are silent killers. If you detect them late, you are likely to lose the individual. When a man is in the war front and he hears that his family is sick and he doesn't know exactly what is wrong, it impinges on his morale. So the Nigerian Air Force decided to set up this cancer screening center to make sure that that is not the problem. We isolate it and enhance the quality of the healthcare delivery that we provide. It is open to the public also, not only the members of the families of personnel and the personnel.
Cancer and other actually non-communicable diseases are increasingly becoming issues all over the world, and particularly even in the developing countries. So the chief is setting this to ensure that no lacuna is left in the healthcare delivery to our personnel. Cancers are also part of the problems that result in morbidity and mortality among our personnel. If not detected, we are all aware that the best way to handle a cancer is for you to get it as early as possible.
Now, meanwhile, reactions or rather criticisms have continued to trail the budgetary allocations to the nation's health sector, with the National Primary Healthcare Development Agency blaming poor primary healthcare services on poor funding. The acting director of the agency said this at a forum in Abuja to discuss sustainable financing options. According to him, over 70% of funding for the nation's health sector comes from donor partners, tax revenue, and out-of-pocket spending by individuals.
The Global Vaccine Alliance, otherwise called Gavi, has provided much funding for primary healthcare service in Nigeria. Gavi's plan to stop the funding of vaccines next year has raised serious concern about how the government of Nigeria will make up for the funding gap that the exit of Gavi and other donor partners will create.
Ladies and gentlemen, all invited guests.
This forum is organized to discuss financing for the nation's primary healthcare sector. The acting executive director of the National Primary Healthcare Development Agency states the effects of poor funding for the health sector on primary healthcare services.
Over time, resources being allocated to healthcare in general has been dwindling, with Nigeria never attaining the Abuja Declaration, which was to allocate 15% of the annual budget to health. The result has been a steady decline of funds to the primary healthcare subsector, which has suffered the most as a result of the dwindling fortunes.
Also, a representative of the Northern traditional rulers at the forum explains how the lack of funding for primary health care has affected their communities.
You look at the primary health care hotspots in these villages, some of them are not functioning. And the areas that they are functioning, manpower are not there.
However, the representative of the Minister of Health, who confirms the underfunding of the health sector, assures of government determination to increase funding going forward.
The administration of His Excellency President Muhammadu Buhari, GCFR, would want to be remembered for its role in making basic healthcare services qualitative, accessible, and affordable to all Nigerians. It's our hope that it would inform an increased allocation to the sector.
Out of the over 6 trillion naira federal government's budget for 2016, 221.7 billion naira was earmarked for the health sector. Experts say this is a far cry from the 15% of the nation's budget agreed by African leaders at the Abuja Declaration in 2001 to be committed to the health sector.
Motorists plying Abuja-Lokoja-Abuja highway were left stranded yesterday following the heavy traffic. We'll tell you how that panned out when we come back on News Across Nigeria.